Doctors of Reddit, what is the most mind-blowing recovery you've ever witnessed? My son is infection prone. In one instance, white count of 48,000 due to a kidney stone. 96 hours after the first sign of a fever he was released from the ICU to home. He had a drain in his kidney, and was off the ventilator about 11 a.m., headed for home just before 8 p.m. Other times, he has been in for weeks and months. Last big stay he seized 4 times in 18 hours. Last time took chest compressions for way too long to suit anyone, had ICU dementia, that's fucking horrifying, and after 22 days came home. Then he has come home the day after getting a new heart valve. Melody valves are awesome, BTW. In April of 2014 my husband was diagnosed with ALS at the Mayo in Rochester after what we thought was a simple visit to be tested for knee replacement. We were shocked, as you might imagine. There is no cure for ALS and average life expectancy after diagnosis is 3 years. In July he retired from his job as a writer/director at a global reinsurance company. As a Christian family we prayed and we believed he would be healed. Every 3 months he returned to the Mayo for tests to see how the disease was progressing. It never got any worse. In January of 2015 he asked his company if he could return to work because he didn't appear to be on the way to death and we weren't in a place financially for him to retire. They had not been able to replace him and were happy to have him back. In April of 2015 the doctors at the Mayo undiagnosed his ALS. In August of 2015 he had surgery at the Mayo to relieve an impinged nerve in his spinal cord. This sounds much simpler than it actually was. It was hoped that over time this would allow his body to heal and correct the foot drop he was suffering that brought him there in the first place. They said this could take a couple of years as the nerves heal extremely slowly. His feet and ankles were checked by a nurse about 6 hours after surgery and all normal strength had returned. All the doc could say was this is very unusual. He's very much alive and still working and has a great story to tell. He calls it his year of living dangerously. This is a truly WTF turnaround for ALS. For anyone who doesn't want to bother doing the reading, ALS is progressive and degenerative. It just keeps taking your mobility, motion, everything have to do with your ability to move and eventually chew, swallow, or breathe. You die trapped in your body. 1 year mortality from the time of diagnosis is about 35%. And then to recover from surgery within a day of having the nerve freed up. This is simply an incredible story. Or a misdiagnosis. I'm a rehab doctor, so this is right up my alley. I saw a guy who was impaled by a 2x4. It literally went through one side of his abdomen and out the other. Somehow, it avoided his internal organs and the surgery team was able to safely remove it. He got discharged to rehab service a few days after admission and we discharged him home a few weeks after that, basically normal guy with some residual pain and new scars. Not a drive, but I work in rehab. This was doing an internship over a summer, over 15 years ago. I had a patient that had fallen from a construction job on the 5th floor. He had fallen on his side with his arm up, thus protecting his head. He had multiple fractures, both arms, pelvis, legs. Urinary cath. He was on a stretcher, unable to walk of course. External fixation on elbow, both sides of his pelvis. I can't even remember what else. By the end of my internship he had regained almost complete mobility in his arms, and was starting to walk again. It was insane. Not a doctor, but this has happened to my neighbor. At my grad party early this summer my 87-year-old neighbor fell on the driveway after tripping over something. He had a pretty large cut just above his eye. A pretty large patch of skin on his arm was kind of peeled back and both of those were bleeding quite badly as he was also on blood thinners. He was also suspected of having a few broken ribs. When they got to the hospital it was confirmed he had broken ribs. 7 of them to be exact. He also had a broken finger as well as the cuts and abrasions he had. About 2-ish weeks later he was in the kitchen flipping pancakes because they had family in town. A few days after that we passed him driving home in his car. This man played on the Detroit Tigers for a few years, retired, bought a horse farm with the money he made playing baseball, raised a couple Kentucky Derby winners. He's, sadly, outlived his sons, had a heart valve replaced, I think his hip was replaced twice, and a few other things here and there. His mind is just as sharp as it was 50 years ago. Nothing stops this man. A YouTube channel / couple, Threadbanger, Corinne and Rob. I've been a fan of for years, just recently came out with this video. I died, but https://www.youtube.com/watch v=Forbes detailing how she found her husband dead in bed. I won't even go into the whole thing, just go watch the video. Very touching and there is a lot to unpack. Are you a donator on it? I watched a private video of Rob in the hospital, but I'm fairly certain it was before the major shit, where Corinne had to call 911 and revive him. It's fucking nuts. I thought they had been away because of that national parks show they were filming, and I know they were heading to Bonnaroo as well. I'm so glad Corinne was up to hear Rob and listened to her gut. And I'm glad Rob is doing better. Obligatory not a doctor, but one of my mom's good friends had been sick for years, basically my entire life, with multiple serious diseases. Even when she let us stay in her house when we were visiting our hometown, she was basically house-ridden. She couldn't have the air conditioning above a certain temperature because it was too hard for her to breathe. She was also in constant pain. My mom got news that she was in the hospital and was not expected to make it. I was good friends with her grandson, and so when I would him, I'd ask about her. She eventually made an incredible recovery. She's still alive today, and while she's not without her problems, she's more active than she's been in years. I'm not a doctor, but this happened to a girl at my school. In first grade, this girl had to use the bathroom, number 2, and the teachers wouldn't let her go alone. After a short amount of time, the teachers made her get out. She had to hold her poop for the whole day and eventually got an infection in her colon. They had to remove the feces from her colon and she was sick for days. The doctor wrote a very rude letter to the school that day. I had a patient during med school, 19-year guy who had had a history of his aortic valve replaced because he was born with a bit of a funky one, bicuspid aortic valve. Well, when I saw him in the cardiac floor, he was walking, talking, totally normal except for a bit of weakness on one side. Pretty much just on that floor for more monitoring and treatment for a vegetation on one of his valves. Prior to that though, he'd arrested in the field, EMS got called and did CPR for 30 minutes, got circulation back, took him to the ED where he arrested again, they got him back and took him up to the ICU, intubated on pressors. He woke up, got better, and got transferred to us. One of the ICU attendings that took care of him stopped by and just kind of stared at him, and said, "You were dead." I think that was a huge win for him. Sorry, I am not a doctor, but my brother had been given hours to live 3 times during his battle with cancer. I flew to see him and say goodbye all 3 times and another 20-odd times to give morale support over the 2 years he fought. One night in the hospital the doctors told us to say goodbye as he had only hours to live. We all fell asleep holding his hand, and at 6 a.m. I opened my eyes and listened to see if I could hear breathing. It was quite dark and all I heard was my brother's voice saying, "Holy SHT, I am still here." He lived for another year. "Holy SHT, I am still here" is a great quote. That line is what makes this story great. Someone brought their cat in that had been missing for a week. It had pulled itself in through the cat flap that morning, dragging both back legs, matted, thin, and covered in oil. Very high likelihood that it had been run over. His right hind was obviously broken with the knee completely in the wrong place, couldn't immediately tell what was wrong with the other leg just by palpating. The owner didn't have the money to x-ray, much less do surgery, and the cat was less than 1 year old, so I offered to have them sign it into my care so I would become financially responsible for the cat. Took some x-rays, hoping for one shattered leg and one relatively normal one, as an amputation was looking pretty likely at this point. The other femur was still intact, but had come entirely out of its hip joint, which pretty much skunked amputation as an option. I'm a passable soft tissue surgeon, but I am not an orthopedic surgeon by any means. So I contacted a friend and asked him if he wanted a crack at the leg. He managed to wire it together for a bit before the wires failed, but cats heal remarkably well, particularly young cats, and he managed to get a pretty functional limb out of the ordeal after several weeks of cage rest and popping the other hip back in. He currently lives on a farm and catches rats, climbs trees, and gets on the barn roof just as well as the rest of the cats. X-ray of his right hind https://imager.com/shay/sysol. My cat when I was growing up had something similar happen. She was run over. We rushed her to the vet who said we could put her to sleep or we could do an experimental surgery, which they would cover due to needing practice. So they wired her legs, fixed her nerves and wired other bits of her. It was crazy. Resident here. This one is more of a mind-blowing remission than an acute recovery. Had one patient in one of my internal medicine rotations in medical school who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone that whole ordeal and appeared to be mostly healthy and was in remission from her cancer really blew my mind. Dad was a stubborn bastard and wouldn't go to the doctor. When he had chest pain with shooting pains in the back and down the arm and drove himself to the hospital, we thought he was dead. That was just his gallbladder, with incidental liver pain I guess. And it turned out to be just about nothing. Then he continued not to go to the doctor even as he had blood in his poop and odd pain and urgent sudden naps and God knows what else. Stage 4 cancer. He had stomach cancer, thyroid cancer, esophagus cancer, and some metastasized into a specific bone. One of his cancers had foreign cancer in it from another one. He was given months to live, and he lost a lot of weight, and we thought it was going to be over soon. But he turned around and made a full recovery in the sense that he was fit and comfortable and running and traveling for I want to say years before the cancer came back with a vengeance and he died. Stage 4 comebacks are kind of crazy. You only expect them to ever limp along after that, at best, and it's weird to see it get better. Physician here. Few and far between if we are being honest. For every terminal cancer that suddenly miraculously disappeared, there's 1,000 others who go exactly the way you'd expect. Anecdotes and television give families an extremely unrealistic idea of the fragility of health. The body is certainly resilient to many illness and diseases even with minimal intervention, but severe illness typically has severe consequences. I've seen people survive cardiac arrest. Then they just code again later in the day in the ICU until they die. If your A1C is 15 you're going to either die or lose your feet/legs. When great-grandma is admitted to the hospital with sepsis, she probably isn't going to make it back to Shady Acres. I don't say any of this to be macabre, but your age and the personal health history that you have walking into an illness or disease make the outcome pretty predictable. I can't count how many times family members have lost their shit during family meetings when they are told that they're alcoholic, diabetic, morbidly obese, tobacco-abusing kin aren't getting better from their 8th bout of cellulitis. What do you mean we need to talk about hospice? If you don't take care of yourself, it's easy to die from even common illness. I hate to be that guy who says not a doctor, but I'm not a doctor. This is my dad's story. He was diagnosed with an 18mm tumor inside his cervical spine. For those of you who don't know, a spine is like 8 to 10 millimeters in diameter. It's a miracle his spine didn't rupture from the get-go. The doctors said he would die, no chance. And most surgeons wouldn't even take him because they didn't want a black mark on their records. The one who did had to sever the spine, cord and all, to get it out, spent years trying to get the remaining fragments, and then my dad went on to have a stroke and 2 heart attacks to make things even more complicated. He's perfectly fine now. Takes like 30 pills a day and can't lift more than 10 pounds, but otherwise you wouldn't know anything was wrong with him. The doctors said his diagnosis was really rare to begin with. Almost every patient who had it either died or became a quadriplegic, so his situation is about as miraculous as you can get. Not a doctor, but a doctor did have this reaction to my case. 3 months ago I got shot in the leg in a freak accident. Not going into details, I get harassed every time I do. Bullet went through my right thigh. What shocked the doctors was the fact that none of my arteries or veins were hit. No nerve damage either. The bullet actually deflected off of my femur and went out the front, which doesn't really ever happen with this caliber bullet. The doctor essentially told my parents that he had done 2 tours in Iraq and had never seen a wound like this be salvageable. He said I should be dead, but by some miracle I wasn't. Still can't walk, but they anticipate that I'll be completely back to normal given enough time. Spinal orthopedic engineer here. A small set of patients whose disc degenerates to a grade 4 spondylolisthesis in a very fast span of time, such as a trauma case, can become either paralyzed or partially paralyzed in their lower body. A 2-hour surgery involving a spinal interbody and posterior fixation can under most circumstances have a patient walking the same day, although that never happens due to safety precautions such as having them rest a day or 2 to allow muscle soreness to fade. Cardiac care nurse here, got called to the ER to assist with a cardiac arrest of this patient in his 50s. He had a delay of 10 minutes, no oxygen to his brains for 10 minutes. The EMT already tried reviving him for 45 minutes on a flat line. After 15 minutes the doctor said, "Last check before we declare this patient deceased," and when we did he actually had a pulse and a decent rhythm on the monitor. Mind you, we use an automatic CPR machine so we don't have to do manual compressions, so we had to turn off the machine to check. He got wheeled to the ICU, ended up on the coronary care 2 days later, pretty confused I might add, and a week later he walked out of the hospital when the doctors discharged him without any brain damage or visual physical damage. Edit, they give him a pacemaker before his discharge. Greater than reviving him for 45 minutes on a flat line. Holy shit, they were determined, good for them. And they not only probably saved his life, they definitely saved his quality of life by doing compressions for that long. I'm an orthopedic surgeon. My colleagues took care of a man who fell 47 stories from a window washing platform and lived. https://www.nytimes.com/2007/12/NY region/08collapse.html Mtref equals www.google.com and gwh equals 9b29d201788789d3d0cdb6ab5f46f340 and gwt equals pay and asset type equals regie wall. Wow, I saw that on a show one time. I forgot what it was called, but they explained how he was able to survive by where he was standing on the platform. I think they said he was in the middle and the initial impact was on the sides, got caught between 2 buildings. It slowed down enough so when it hit the ground there was less impact. An incredible story of, well, I don't want to say luck, but phenomenal odds. So sad that his brother died though, what a burden to bear. Resident here. When I was a medical student on a cardiology rotation, we had a very nice 40-year-old lady that was being treated for a heart attack, kinda young, but okay. This type of heart attack, deemed an STEMI, is the type where she did not have to be urgently rushed to the cath lab. So she had hers the morning after she was admitted, seemingly fine before going down. While in the cath lab, she spontaneously went into cardiac arrest. They got her back after 2 shocks, multiple rounds of CPR, and a round of epi. Usually, if someone is coding for a while, it doesn't look good for them. But she came back and was intubated, so it's more of a watch and wait deal after. Well, overnight, she self-extubated herself. When I rounded on her in the morning, she was awake and said she felt fine. Her only complaint was that she felt like she got burned on her chest, and that was irritating her a bit. Yay, that was the 200J of electricity going through you a few hours ago. She then went on asking when she was going to be discharged because she needed to go home and take care of her 2 dogs. The fact that she went into cardiac arrest in-house and in a shockable rhythm definitely helped her chances of a good outcome. But it's still one of my cooler stories. BC, contrary to what people see in the TV shows, people don't just wake up, eager to take on the day, after cardiac arrest. I had a guy like that. He rolled in with an Instamind coded in the trauma room, was quickly coded and actually woke up asking the trauma nurse to stop compressions. I cared for him the next day after his angiogram and he told me that story. I hadn't before realized just how much he scared the crap out of the trauma nurse. Smile. Not a doctor but a nurse who worked in long-term care. I had a patient who was apparently actively dying. She had stopped eating for 3 to 4 days and was on comfort measures only. This meant she was receiving morphine every hour and the rest of her medications were discontinued, and she was only being fed and given water as tolerated. Out of nowhere one day she just sat up and said, "I'm hungry," and like that she was back to normal. She lived for around another year or so after that. That's interesting. In hospice, I saw patients typically get that burst of energy before they transitioned. I liked the perspective that it was the universe's way of giving the person a chance to say their goodbyes to their loved ones. Resident doctor here. I've seen this happen before in palliative care. It's usually due to decreased cerebral edema as the patient starts to dehydrate. They suddenly get better and then die over the next short future. Obligatory, not a doctor, but I knew someone at college who was meant to be dead by age 8. Like 8-year-old that has written a will, kind of meant to be dead. They have a whole host of medical issues which I can't remember because they're all rare, but I know they were out of school for something like 3 years because they were being passed around every children's hospital in the UK getting various surgeries and treatments. They aren't necessarily recovered, but they've survived a further 11 years than they were supposed to. Not a doctor, but the recovery of Anthony Borges was miraculous. Kid was shot 5 times at Stoneman Douglas while protecting classmates. Had seen a lot of remarkable recoveries back to baseline from people unconscious and intubated in ICU. Especially in young people who have high physiological reserve to bounce back from catastrophic events, for example thyroid storm, aneurysms, ketoacidosis. I'd say the most surprising recovery was in a drug and alcohol patient. Man in his 20s with a very difficult upbringing, dropped out of high school at 15 and was just hooked on meth and alcohol since. Very expensive habit, so he'd commit crimes to fund the drugs, get out of prison and back to us for rehabilitation, commit another crime. A horrible cycle. He wasn't motivated to recover because he didn't have much of a life to return to. Serious health problems from drug use, nobody would hire him due to his criminal record, parents in prison. Also seemed mildly intellectually impaired, possibly from chronic drug use. He only had his girlfriend. Then his girlfriend died of a drug overdose. I thought he'd follow after because he was hanging on just for her. But he did a total 180. Booked himself into detox, attended all his appointments, got his high school equivalency. Stayed clean for years and got hired as a security guard. On discharge, he was with a new partner and they had a baby on the way. During his last appointment he dropped into the dollar store and had a bag with a stuffed elephant and pink blanket inside. Just wow. That's some will right there. As a resident I admitted a patient for a COPD exacerbation. Pretty routine. What wasn't was her history. She had been discharged from the hospital 4 years before with hospice. She had biopsy-proven small cell lung cancer that had metastasized to other organs. Essentially zero survival, and she had gone home to receive medicine to make her comfortable. She hadn't taken any cancer treatment. 4 years later when I admitted her there was no trace of cancer. The only suggestion from the pulmonologist was her crack cocaine habit must have been lethal to the cancer. Or her body just found a way to fight it off. Basically we don't know how, and her odds of doing it should be about 0. I'm a patient, not a doctor. I was diagnosed at 22 with lupus and got acutely sick very quickly, which is a little out of the ordinary for the disease. Long story short, it's almost killed me a few times, but I'm lucky enough to call myself healthy for the time being. I've had a lot of doctors and met a lot of rounding med students since I'm a fun teaching case. Anyway, a couple years ago I was out with my daughter at a park and I ran into the doctor who originally diagnosed me forever ago. I was acutely ill at the time I met him and my prognosis was pretty grim. I hadn't seen him in over 10 years. He hesitantly walked up to me and asked my name and then yelled, "Oh my God, you have a daughter." Honestly, I have never seen a grown man so excited in my life. He was almost giddy. He wanted to know everything about how I had been doing and just kept smiling when I said I was married with kids and had been feeling good for the past few years. It was such a chance run-in, but I'm so glad he got to see me doing well, since he had seen me at my absolute worst. Makes me smile just thinking about it. Smile. Not a doctor, but the patient probably not as mind-blowing or serious as others, but I have had an eating disorder, anorexia, since early teen years. Apparently it was really bad to the point where my body was shutting down. Anyways, my therapist at the time refused to see me and deemed me as untreatable. I've seen multiple doctors who thought the same as well. I was also in a residential treatment center where they said I'll most likely be in and out of centers my whole life if I survived. I was deemed untreatable or helpless by most people. Come to think of it, I'm not sure if I had anyone in the medical field who believed in me. Not even my psychiatrist knew how to help. I didn't think I'd live at times. Like I said, I heard it was pretty bad. I couldn't see it of course, but others did. Flash forward and it's currently 3 years since my last residential treatment stay and almost 5 since my first. I wonder every now and then what they would think if they realized they were wrong, and while I struggle from time to time, I'm still alive and fighting every day. Paramedic fireman here. Had a guy, 65-ish years old, who dropped dead while on a treadmill. Leads showed asystole, which means dead as hell, 0 electrical activity in his heart. 1 round of CPR with 1 round of ALS meds, goes into a shockable rhythm, defibrillate, shock, 1 time, guy gets a normal heart rhythm back with a pulse. Loaded him up, had a 5-minute transport. By the time we got to the hospital, this man was making jokes with us and would have walked in if we let him. This is not how cardiac arrests go. You usually die. And if you live, your quality of life after is usually greatly reduced if not negligible. This was absolutely incredible. I had something similar happen to one of my patients. Guy came in with chest pain and arrested right in the waiting room. CPR was started immediately, was shocked twice and came back. Had no idea anything happened. Sent us a basket of fruit every year on the anniversary with a card saying thank you for saving my life. I don't work there anymore, but I'm sure he still sends it, if he's still around. That's wild. That immediate response is the X factor. But even then, who knows? It's a crapshoot, but at least it's a crapshoot. I was an intern working in the MICU during flu season. An elderly woman came in with respiratory distress due to the flu. She was already in bad shape prior to this, COPD, heart failure, etc. She was subsequently intubated, started on bedside dialysis, went into liver failure, developed an allergy to heparin, to name a few. She was maintained in a medically induced coma for about 2 weeks because she could not be extubated safely. Long story short, after about 6 to 8 weeks in the hospital, she went to a rehab without needing a trache or dialysis. I'm still surprised how she managed to make it out. A kid who had a 3% chance of survival with surgery and still survived for 2 years and lives to this day. Diabetic with Fournier's gangrene, do a quick Google image search, had to be debrided and was basically flayed from mid-thigh to the pubic area, down to the muscle. Surgeon did a stellar job on debridement, and the patient, albeit had a very long inpatient stay, had all things considered a pretty incredible recovery.